Here are 40 must-know facts to pass the CNA nursing assistant exam. Grab this as a free cheat sheet, just search PrepPass.org. Let's go. HIPAA Privacy Rule, 45 CFR Section 164.502 and 42 CFR Section 483.10 G, protect resident health information. Welfare and Institutions Code Section 15630 makes CNAs mandated reporters of elder and dependent adult abuse. The right to personal privacy and dignity during care is guaranteed by 42 CFR Section 483.10 E and California HSC Section 1599.74. 42 CFR Section 483.10 F 11 protects residents' rights to exercise their rights as citizens, including voting. 42 CFR Section 483.12 A1 prohibits verbal, mental, physical, and sexual abuse. HIPAA, 45 CFR Section 164.530 and 42 CFR Section 483.10 H require minimum necessary disclosure and reasonable safeguards. Per 42 CFR Section 483.20 G, documentation must be accurate, objective, factual, timely, and within scope of practice. Cultural and religious end-of-life practices are protected expressions of resident dignity under 42 CFR Section 483.10 E. Cultural humility and person-centered care require accommodating fluid temperature preferences. Joint Commission National Patient Safety Goals require readback/repeatback for verbal communications to prevent error. Language access is a legal duty, Title VI, HSC Section 1259. TB is transmitted by airborne droplet nuclei. Oxygen accelerates combustion. Elopement is a leading sentinel event for residents with dementia. Influenza is spread by respiratory droplets that travel about 3 to 6 feet. Norovirus is highly contagious via fecal-oral and aerosolized vomit. Isolation signage must clearly indicate type and required PPE. Normal adult resting BP is roughly systolic 90 to 120 and diastolic 60 to 80 mm of mercury, per AHA fundamentals. The radial pulse is the standard for routine adult vital signs, accessible, comfortable, and reliable. Dentures are fragile and expensive to replace. Diabetic neuropathy hides injury, ulcers and amputation risk are high. Normal adult resting heart rate is 60 to 100 beats per minute. Supine, lying flat on the back. Sputum is best collected early morning before eating/drinking/brushing because overnight secretions are most concentrated. ARM, resident performs the movements independently, maintaining strength, flexibility, and joint health. Per Title 22 CCR Section 72315, transfers must protect both resident and staff. 42 CFR Section 483.24 B requires the facility to support each resident's ability to perform ADLs and to prevent decline. Foot drop, plantar flexion contracture, develops when the foot remains pointed downward. NPIAP staging. Stage 1 equals intact skin with non-blanchable erythema, redness that does not turn white when pressed. Heels have minimal subcutaneous tissue and high-pressure injury risk. Expressive, BRCAs, aphasia means the resident understands but has difficulty producing speech. Validation therapy, Naomi File, honors the emotional reality behind the words rather than correcting facts. Loneliness and isolation accelerate cognitive and functional decline. Depression in older adults is common, often missed, and dangerous. It raises suicide risk and accelerates physical decline. 42 CFR Section 483.10 E and Section 483.12a(2) prohibit physical or chemical restraints imposed for discipline or staff convenience. Loneliness is a serious health risk in LTC, linked to depression, dementia progression, and increased mortality. Difficult family dynamics are common and rarely about the CNA personally. Substance use disorder in older adults is under-recognized and dangerous: falls, GI bleed, drug interactions. Under WNI Section 15630, a CNA in a long-term care facility is a mandated reporter of suspected elder/dependent adult abuse. 42 CFR Section 483.10 F11 protects each resident's right to religious and spiritual practice. Want all 40 on one page? Grab the free CNA Nursing Assistant cheat sheet and the full practice test. Search PrepPass.org. Good luck on your exam.